joining on Zoom and now live on multiple channels and the Health Data Forum. It's good to be back online with all of you today. So without further ado, I'm giving the floor to Steve McFeely, Health Data and Analytics Director in WHO, a renowned statistician that is dedicated his lifetime to health data, and now in his executive position at WHO, the champion of a cause that is now a cause that we should all be supporting, a global cause. It's really great to have Steve McFeely here with us in this Global Health Talk in the Digital Health Week. Steve, the floor is all yours.
Great, thank you, Paul, and good afternoon, good evening, good morning, everybody, wherever you're joining. So, Paul, a quick question. Should I share my own slides?
Yes, you can share your own slides whenever you like.
Okay, so hopefully I can find them.
If not, I can give you a backup here.
Yeah, I'm just trying to figure out which slides to share. So just bear with me a moment. Apologies. Here we are.
Yes, we see your screen, but it's not maximized.
Okay.
Fine.
Okay, great. So thanks, everybody.
But you're muted, Steve.
No, he isn't. We can hear him.
You can hear me? Okay, great.
We can hear him fine, yeah.
Yeah.
So I'm going to talk about One Health, and I'm looking at One Health from a data perspective. So first of all, a little bit about what is One Health. So One Health is the idea of an integrated, unifying approach that balances and optimizes health, people and animals with environment. And I think we all saw the importance of this post-pandemic. So the approach mobilizes multiple sectors, disciplines, communities. So it's basically that we're looking at one system rather than many systems. So, and crucially, I guess, it involves public health, veterinary health, environmental sectors. One of the shortcomings, perhaps, is that it hasn't. One of the ambiguities for me when we look at this is how you define public health. So for me, what would be very important in this discussion is that we include things like economy, and we also include things like society, because they have a major impact on public health. So when we look at the agencies that are involved, like UNEP and stuff, that makes sense, but I think it would make sense to include other agencies as well, not least agencies like UN Habitat, because these really have important implications. But let's put that aside for the moment. So if we're really interested in looking at a unified system, then we need to step back and look at what are the enablers that would allow us to do that. This is taken from an old paper that wasn't about health specifically, but I think it's apropos the discussion today. But one of the key enablers we need really is a functioning national statistical and data system. And very simplistically, that's made up of 3 blocks. Up at the top in the green, we could call this, broadly speaking, we can call this governance, but we need strong legal frameworks that allow us to manage data properly. So this is things like data protection, statistical confidentiality, proper legal access to primary and secondary data that's managed correctly, and then professional independence for the statistical office. But more broadly, as I said, we need kind of governance frameworks that allow us to manage the data safely. The next thing is we need to, if we move our eyes down to the orange structure, we need to put in place proper data infrastructure. And what I mean by that is, and this is different to digital infrastructure, this is really about data. This is how how we manage the data itself. So what classifications do we use? Do we use unique identifiers? And I would argue that we should do. And crucially, we need at least 3 types. We need a unique identifier for persons. We need a unique identifier for place, which is the GIS component. And then we also need a unique identifier for businesses or facilities. So health facilities are different to people. So we need to be able to manage those 3 pieces, and we need to be able to connect them. And then finally, often ignored is the blue section, which is institutional coordination. And this is the marriage of statistical and data expertise with specialist expertise. This could be local, this could be topical, and also with geographic expertise. And really, it's absolutely essential that that's institutionalized and isn't based on just individual relationships, because as we know, people leave and then systems fall apart. And put together, this is what I would call the national data infrastructure. And that's really the prerequisite to anything around one health or one data. Another key piece, just to emphasize the data governance piece a bit, if we're looking at One Health and we're looking at the data elements of One Health, then we really need to have strong governance around those data. So these are just some of the components that this would include. So this would include data principles, as I mentioned, data protection, also data quality. What are the standards that we're setting? Particularly within governance, we need to be clear on how we share data. What data are we allowed to share? What are the conditions for sharing those data? Anything around data security and the management of the data. Metadata catalogs, which says exactly what those data are, and all of the cataloging systems around that. Clearance and dissemination, so what are the rules and guidance around producing the data and making those data public? This is very important when we draw distinctions between microdata and aggregate data. And then obviously more future looking, but what are the links between data governance and digital governance? What are the links between AI? Because data obviously is one of the major fuels for artificial intelligence, but also for larger digital products. So it's really important that digital governance and data governance are connected properly. On data quality, there's many models for data quality. The one thing I want to talk about really here is the importance of the institutional element. Too often we tend to look at data as a technical issue only. So we look at output and we look at process, and we ignore the importance of institutions and institutional culture on data quality. This is particularly important in the context of the UN, which is an overtly political organization, and the statistical entities within it operate within a very political environment. So things around statistical coordination is really important, but also the protection of objectivity and impartiality, of transparency within large international organizations is absolutely essential. That's not just important at a national level, it's really important at a global level. And obviously it's very important for local level as well. And then literacy. We can produce all of these data, we can manage all of these data, we can connect all these data, but it's really important that people know what to do with it. And in fact, this is where we see one of the biggest challenges is we're producing a lot of data and then countries, analysts aren't really using it. They're not getting value out of it. And data and statistical literacy has become more complex in recent years. So now I would argue it's a combination of both statistical and numerical skills, but also technological skills. And all of that must be put in context. It's very important that the systems that you operate understand the culture that you operate in, and also the elements of civil society that define that culture. And if you don't understand that context, then you're going to make mistakes. So this is one of the crucial points. Data and statistics are not just technical issues, they're political, and they're very, very normative based, they're cultural based, and you need to understand those. So these are really, when I put all of these together, these are the enabling factors, I think, when we want to talk about One Health and digital health. These are the bits that we need. And I'll stop there. Thank you very much.
Thank you, Steve.
Thank you so much, Steve.
It's great, Steve. Thank you so much. So I think that this is creating a nice head start for our panelists to intervene. I would open the round for the panelists to please start their interventions by briefly introducing themselves and using alphabetical order. Anna, Beatrice, João, and last Jocelyn. So briefly introduce yourself and first comments from this wonderful opening presentation by Steve McFeely. Anna, over to you.
So, thank you, Paul. Thank you, Steve, for this introduction. My name is Anna Sepúlveda. I'm working on longevity, seeing longevity is a new area in the global economy. This is my focus. So I run 40 Plus Lab, is a consultancy company, and also a business association here in Portugal called Age Friendly Portugal. Based on that, my first comments are, first of all, is I see, and not only me, longevity is more and more a new area in the economy. So it helps as a result of all this investment in longevity, in promoting lifespan. What we see is not only more research, but also the innovation in terms of longevity tech solutions and age tech solutions. So all of these produce data. And the question is, how do you design? How do you analyze this data? I give you a quick example. It's not often when I see people that came show me the startups and, for example, in age tech, and saying, I'm going to develop this for elderly people, and the data will be shared with the doctors and with the family. They don't mention, for example, if they're going to ask the elder itself, himself or herself, is going to allow this data question. They don't pay attention. It takes me for my second point for starting the comments is the citizenship concept. Especially when we talk about aged people, we tend to forget that they are a citizen as an adult, as a children, so the data protection is important. And especially in terms of living in a society with new business models, we see and we know that longevity will be a financial asset. So we all evaluate, or in terms of insurance, sooner or later, our level of risk will be associated with our biological age. So the question is, for example, in a company, in an organization, if I have a politic to promote my employees' longevity, what kind of data do I should have access? How do I manage, for example, if other company that make an assessment to my employees, and they identify 4 or 5 people that are in risk or higher risk or mental disease or any other thing, what should they do in this case? Shall they tell me, point me, the people, to whom they will report this kind of situations? So when I see longevity, my focus is on the economical side. What concerns me is how will we democratize this, and the longevity literacy, of course, it has to do with data, and then all the ethics around it, something that Steve, in a certain way, already touched. So I think for starting comments, this is what I wanted to highlight.
Fantastic, fantastic. Thank you so much, Anna, for bringing your perspective. Beatrice Okesh, over to you now, the opening statement.
All right. Thank you so very much. If at any point you lose me, please let me know. So as mentioned, my name is Beatrice Okech. I'm based in Nairobi, Kenya, and I'm the Advocacy and Campaigns Manager at Transform Health, which is a coalition of over 100 organizations that work to advocate for the equitable digital transformation of healthcare systems. And a lot of our work revolves around building consensus, influencing decision makers, and mobilizing communities on three key areas where we're calling for stronger political will for the digital transformation of healthcare systems, calling for a health data governance framework, and also increased and coordinated investment for digital health as a key driver for universal health coverage. And so just to start off my opening remarks, it is very interesting and very exciting to see how One Health, the all-encompassing nature of One Health, really, in the sense that a lot of the times I think we think about public health, for instance, in a sort of narrow manner, but the perspectives shared by Steve have been super refreshing just to listen to, and particularly thinking about how it interlinks with the work that we do at Transform Health around health data governance, reflecting on the work or on the fact that as time goes by and as digital health becomes more entrenched within our healthcare systems, we're producing a lot more data, but how is this data stored? How is it collected? How is it managed? All those very many questions that arise and how that fits into the issue of health data governance. So that's definitely a great place to start. And I do look forward to share more perspectives around our work on health data governance and how they could fit into the One Health conversation. Thank you so much.
Thank you, Beatrice. Awesome. As initially planned, I think it's over to you now. João, alphabetically before Jocelyn. So initial comments, and please briefly introduce yourself.
Yeah, thank you, Paul. João Bocas, based in UK and Portuguese national. I always say I'm a global citizen, CEO of Digital Salutem. I'm delighted to be here with you all. Good morning, good afternoon, or even good evening to some of you. Nice to see some familiar faces. And Paul, thank you so much for the invite. Steve, that was truly fascinating. I love, of course, you share some global challenges around data. When we talk about data, it's not the case today. But when we talk about data, I always feel like I want to pull my hair out, because I go to a lot of events and we have these discussions about data. And the challenges seem to be not solved, and we go around in circles for 8 or 10 years talking about the same thing. Who owns the data? What can we do to improve? But that's not the case today. It's a completely different discussion. But I love the approach of One Health, because you really truly consider other aspects in terms of public health, with animal health, ecosystems, and everything. That's really, really innovative. And we're not just talking about health data. But bringing back to health data, I do a lot of work in digital health with large organizations, startups, and public organizations. And of course, we need data. And you mentioned in your presentation some of the challenges around governance. Data is more or less like our best friend and our best enemy at the same time, because we need data to innovate with the available technologies, artificial intelligence, machine learning, wearables, whatever that is. But at the same time, I'm hearing a lot of people in healthcare saying now we are in the opposite direction. We almost have too much data for clinicians to deal with. We have these big challenges around unstructured data, seeing data that we don't need when we go to a doctor. And we have all these global challenges around the shortage of clinicians. We have the challenge of the wearables bringing a lot of data, but they don't bring the right data. We actually just have one. For example, we are interested in one data set and we get 7 or 8. And of course, we have the other things that are adjacent to that, cybersecurity, privacy, and so forth. But I really loved your perspective and also your approach around what you're trying to bring forward, that is not just about health data, but truly public health ecosystem. And I think one of the things that is definitely missing at the moment is more public health initiatives. And I'll give you a couple of examples and I'll leave it there. A few years ago, I live in UK. We hear a lot of public health initiatives such as smoking cessation, awareness around certain diseases, the campaigns around nutrition and increase fruit intake, things like that. And now very little is happening. And truly public health and global health is suffering. As a citizen, I try to keep fairly healthy, but I really see is very little going on. So seeing initiatives like One Health is truly inspiring, and we need more work, and we need to push these things forward together. And I'm very passionate about that. Steve, thank you so much.
Thank you, João. And Steve, over to you. I think there's this initial comments is going to ask you for another intervention, and then probably we'll follow from there the conversation. Steve?
Paulo, excuse me, we have a question here from George Matthew on our chat.
Okay, cool.
Yeah, I see it. So I'll stuff that into my
Thanks,
my remarks.
Thank you.
So, yeah. So to Anna's points around longevity, I mean, I think this is really interesting because it does bring up challenging discussions around citizenship. But the crucial point, when I'm talking about governance, I'm using it in the widest sense of the word. So let me clarify. Governance, in my view, explicitly includes ethical issues and ethical management. And the example you used around permissions, this is absolutely essential. Any data that we're going to collect and then share, the people whose data that is need to be aware of that. And that's absolutely essential, because if we think not just about health, but if we think about just the economy more broadly, there's data moving around all of the time. What we want to do is facilitate the movement of that data, but try and put in reasonable protections around the data at the same time. So we don't want to stifle innovation. We want to facilitate innovation, but we want to do it in a safe way. Now, one of the debates that this surfaces, certainly in Ireland where I come from, but I think this is probably true everywhere, is there's a spectrum between, on one side, efficiency, and on the other side, privacy. And I think a lot of countries, a lot of peoples, a lot of citizens haven't really had an honest conversation about where they sit on that spectrum. Because I would argue, from a government point of view, they have to have a certain amount of information to manage systems properly. And the question is how much data, because the more data they have, potentially the more efficient they can be. The less information they have, arguably the less efficient they can be. Trade-off. And again, this is why I brought up the issue of culture, because culture really informs this discussion. So there's no right answer, and I think every nation really needs to have that conversation. The issue around health insurance is really interesting, because another conversation that I think we can have is the different individual risk. So if we go down the pure data model, it's probably dragging us down the individual risk model, which means your risk is probably increasing as you get older, well, almost certainly. So if we go the shared model, we distribute the cost, and that's arguably better for managing the financial burden to households. But then it means we all share that we're paying more insurance at the start when we're younger and fitter. but we understanding that will play less insurance later on, or we go the individual model where it's just based on pure risk. And these are huge questions for countries and governments to think about. But I think they need to have those discussions with the citizens of the country. Beatrice's point, I mean, I've really only one point here because I'm well familiar and I work closely with Transform Health. So the main issue here, I think, around the work that their health data governance, it's really important, and their health data principles, I think, are really excellent. But it's to make sure that if we're taking the One Health approach, and in fact, you could even step back further and just think about one people, one government, whatever you want, one whatever. Health isn't disconnected from everything else. I mean, health is part of society, it's part of the economy. So whatever we do on the health data governance piece, it's really important that it's consistent with the wider discussions on data governance more broadly. Then on Joe's point, I enjoyed your intervention. So yeah, I mean, data are our best friend and our worst enemy. I think this is the dilemma that we're facing now, where when I began in the statistics office in the early 90s, the issue was we didn't have enough data. Now we're kind of overwhelmed with data, and yet we still don't have enough data in some parts of the world. So it has created a data divide. And also, we still don't necessarily have the data we want. So what we see is we've generated a lot of noise, a lot of reproduction, but we don't necessarily have all of the data that we want. And that's really, I mean, I think this is where kind of data science, statistics can really play a role, and needs to play a greater role in filtering out all the noise on the margins and getting to the key pieces so clinicians get the data they want. And for me, the interesting challenge or the interesting piece of work is pulling that data out of systems that already exist, so we don't burden patients and clinicians with more and more questionnaires, because the data are probably there. But again, how do we do that in a safe way so that we're really managing stuff? And then to George's questions, so first of all, I think legal frameworks are really important, because years ago, we tended to think of data as an input into policy making. We use data to inform policy, but now data have become so important. They're actually a policy issue in and of themselves. They're crucial for gender issues. They're crucial for national security. Like they really have become. So we have to have legal frameworks that manage this resource properly. It's no longer acceptable that we don't. The challenge in the second part of George's question is, what do we do then in countries where we don't necessarily have proper data protection in place? And there's two dimensions to this. One is, if you don't have data protection or statistical legislation in place, then citizens in that country are at risk. Obviously, their data can be misused and nobody's accountable. But secondly, from the broader picture, when we think about the aspect in the health sector, that maybe in the future I can carry my data around on my phone, so every time I go to a doctor, I have my own records. To do that, to actually facilitate that, we have to have shared data protection and data governance in place, so that I can, as I move around the world, I can take my data with me safely, and there's no risk that it's going to be harvested by somebody else. So this is an enormous challenge, and I've just put in the chat a link to a very interesting paper with a set of appendices, and just to explain quickly what it is. The CEB is the Chief Executive Board of the UN system, and Angela May from the Office for Drugs and Crime, we've been co-leading a process on looking at international data governance and trying to figure out a way for the UN system and member states to think about this in a kind of a non-controversial way. So I would encourage everybody to read, because health is a really important sector of this, but it is only one sector. And we really need to think about this in a very holistic way. So I'll stop there, Paul. I hope I've some way addressed the comments and the questions in the chat.
I certainly think so, Steve. Thank you so much. I think that we can do another round with panelists and then take advantage of our meeting room participants here to do a little bit of a show of hands of who is from outside Europe, who is from Europe. I will do that in a minute. I will give the floor now to panelists to do a second round. I will be kindly asking our participants to turn up their video, the ones who are outside the Europe, and then the reverse, and then we can see who is here in the room and hear a little bit from you. So for the moment, panelists, over to you, and perhaps now without any particular alphabetical order, who wants to summarize what we have discussed so far and bring another angle?
I would like to just to put two other questions on the table regarding to that.
Sure.
When we talk about the aged population and all the challenges ahead, when we see countries with a lot of people over 60 or 65, one of the comments that usually came is that the working population is shrinking. One of the good things about having updated data and like I'll call this live data, is data that comes very easily in a very frequent way. It still allows us to answer one of my key questions when I look at this is, in terms of working population, who is effectively working, because we know, for example, in Portugal, and there is some information about it, that people over 65 still working, but I don't know who are there. I don't know what the percentage, I don't know what are they doing. And especially if you look at the Steve concept of health, it makes even more sense. So for me, this is one of good things. The other one, and related to what we already talked, which is privacy, something that concerns me is how do we educate the new generations, their concept of privacy, their concept of the understanding of the kind of information they give about themselves and what they have in return. We don't have this literacy for privacy and for data protection. We're talking about citizenship here, is something that Steve already touched, but I just would like to put the focus on these two topics.
Amazing. Thank you so much. Anyone would like to intervene, panel members?
Yes, hello. I would like to take the floor as I haven't had a participation. Hi, my name is Jocelyn Carillas. I am the Global COO at Recainsa. We are a digital health network established in 2013 in Central America, basically in Guatemala. And we are working with different partners, one of them Transform Health precisely. We are the regional partner for Latin America. And definitely that this is a topic of great interest, speaking about One Health, because it's not something that we are really including in our agendas in my region. So for us, it's very important to link this with the work that we're doing, promoting the strengthening of the governance on digital health in the countries of our region. First of all, congratulations, Steve. I have really enjoyed your interventions, your introduction, because you have mentioned so many topics that we have been trying to pull in the Americas. And definitely that technologies play a very, very important role, especially to link human health, but also animal health and environment. That is something that not everybody's, as you mentioned in the beginning, this is something that is not just a topic that should be keep busy some governmental agencies, for example, or some donors, but that needs to involve different stakeholders in order to get the best benefits of data. Because everybody's generating data. We all know that. But how are we taking the best advantage of this data to take the best decisions to benefit our populations? I think that is something very important, and that we need to start seeing as a whole and not like different islands that are working by themselves. So going back to digital technologies, that is something that we promote at Recainsa. I think that it is very important to mention that technologies can enable real-time data collection, the analysis, that communication. Technologies can allow for early detections and response to potential, but also an effective governance models can ensure that this data can be managed responsibly and securely with clear guidelines on data sharing, privacy, and consent. That is something that we have been promoting with Transform Health, Recainsa, and other partners from the principles of the governance. But can governments, can stakeholders, can do this? Do they know how to really do this? I think that is the very first beginning. And I think that the principles give us this guide that can help different stakeholders start putting real action into these roles that we need to take.
Thank you so much, Jocelyn. And I apologize if I missed you in the first row. I'm sorry about that, but it was really good that you take this intervention now. And anyone else from the panel, Beatrice, or because I see Steve busily taking notes, is going to make a comment before we open the floor to our participants here.
I'm happy to speak a little bit more about our work. Just jumping off of what Steve said earlier about our work around health data governance. And also, as he talked about the need for legal frameworks, we find that that's super important in our work at Transform Health. And I will, share some of the lessons that we have, learned along the way. And I believe this is a good sort of space for us to start to see how that could also fit into the wider One Health agenda, seeing as our primary focus is usually on health data governance. And a huge starting and I'll tackle this in two ways, and I'll try to be very quick about it to save time. So the first one is around sort of the legal framework end of things. And then the second, I'll talk a little bit about how through our work, we're trying to bring on board, grassroots movements and people and citizens to sort of have this public and political conversation on health data governance, and how we find that could start to address some of the questions around does the healthcare system, is the healthcare system a custodian of our health data? How can we also start to, as citizens, learn about our health data and the like? So a really great starting point is the fact that healthcare systems are consistently digitizing. We're hearing that on one end, there's too much data, on other ends, there's too little data. And there's this, incremental sort of digital divide. And so as we see this recognition coming up, we also recognize that there's a need to strengthen the regulatory environment. And we're already seeing countries in different places and in different continents instituting health data governance policies and legislation. But at the moment, there's no overarching consensus on what should be the minimum standards or components or considerations for national regulations for the effective and equitable governance of the health data. And so that's something that we are tackling at Transform Health. And this is in recognition of the complex and diverse landscape of regulations and legislations across countries, as well as the many gaps that there are in this sort of space. And so we see the value in countries and other stakeholders coming together to learn from best practices and also to explore where the current gaps are with regards to regulation. And so what we're trying to do with this is to build consensus and alignment between countries on what minimum and optimal regulations should look like for the governance of health data, and essentially establish a minimum set of standards or key considerations for health data governance. In our work earlier, we were calling it the Global Health Data Governance Framework. And so for this, we need, high-level political commitment, but we also need to, really have strengthen our partnerships on this issue and really build consensus on this issue. And we believe that by having these frameworks or this framework or these considerations, we would be able to have a guiding resource and a benchmark for many governments to strengthen their national approaches, while also improving harmonization across countries, which is important for cross-border data flows with the needed protections in place. So a key component of our work to really summarize it is how do we ensure that health data is being used for public good, and regulations are a really great way to start. And these common sets of standards would be a really great starting place for governments as well to then have sort of a baseline for what would be needed to learn from countries that have already started to make progress on having health data governance frameworks within their spaces. And then I see that this would also create an opportunity for us to start to look at how does this conversation around health data governance fit into the issue of One Health. And this is where I would speak a little bit about around our work on health data governance. We also have the campaign My Data, Our Health, where we've reached out to our partners in 6 different countries in Africa to really build this conversation, a public and political conversation around health data. And we start to see questions around who owns this data? Do we as citizens have access? Should we have access to our data? Who is the healthcare system a custodian of this data? And we find that by having these conversations and by having these voices, sort of start to fit into the conversations around health data, we're also able to start to look at what are the actual needs based on different regions, different contexts on the issues of health data governance, starting to look around questions to do with data privacy as well, rights and ownership as well, and how that overall fits into the issue of health data governance and consequently issues of One Health, with the overarching sort of goal being universal health coverage. So that's just a brief sort of take on our work, feeding into a little bit of what Steve had shared earlier.
Thank you. Thank you so much, Beatrice. But it's really a conundrum, right? Because if you approach governments with a formula based on benchmark from other governments, we always have this syndrome of not invented here rejection, right? So it's really to try a balance between, of course, bringing good ideas, but also make sure that there's space for generating local ideas also, and then make sure people participate in the change, obviously. But Beatrice, I congratulate you for your work, and I'm sure that here in this panel you'll find with Jocelyn Carius another enabler for your activities in South America. Steve, over to you to make a comment, and dear participants, please prepare to intervene now. I'm going to ask you after Steve comments here to do a little bit of an exercise to see who is in the room. Steve, over to you.
Okay, so thanks to everybody for the comments, some fantastic comments. So I'm just going to pick a few. So Anna was talking about basically thresholds which affect what we as statisticians call dependency ratios. And this is the ratio. So basically, we imagine society as, you can think of it as a normal distribution, and the two tails are what we use on rather unflattering language, we call them unproductive. So just put aside the prejudice of the term. So basically young people aren't working and they're not contributing to the tax take. Equally, when people retire, they're not contributing to the tax take. So people in the middle are the productive. They're the people who are working and paying the taxes. And this is a huge issue now, because as people they're entering education or staying in education later, but they're working longer as well. So the dependency ratios are shifting, but also they're shifting around the world. I mean, over the next, in this century, we expect the global population to land somewhere between 9.5 and 11.5 billion people. Most of that growth will happen in Africa and in Asia. In fact, even in the next 30 years, we expect the population of Africa to double, which is absolutely incredible. What that does, I mean, that blows any dependency ratios out of the water, because suddenly this huge influx of young people, full of potential, but it causes its own challenges too, because they all have expectations in a globalized world. So this whole concept of working age, dependency ratios, that feeds in as well now to the discussion on migration. Because we see the population in Europe starting to decline and age. And this is the joy of data. It surfaces and makes clear some very stark issues, some issues that are often difficult to talk about. But the data it shows that if the European welfare model is to be sustained, we're going to have to import a lot more people. And that's just a fact of life. And then that has issues for health, of course, because we've seen even during the migration surge coming out of the Ukrainian war, because of different vaccination rates, prevalence of different diseases, as they come into Europe, we had huge concerns around the health status of those migrants, and in particular around things like TB. So anything that had a potential for contagion. So imagine now if we have massive migration in the years to come, and we're looking at migration from a health perspective, apart from a political economy perspective, there's huge challenges being posed for the health services. On the literacy, I agree. I mean, I think there's huge challenges around literacy. So let me just single out two. One is it's a curiosity to me that so many of us are willing to provide so much information to supermarkets or to other private entities to get some small discount. And yet we're so nervous then about providing data to government. I find that an interesting dichotomy. So it's clear that supermarkets have managed to sell the benefits much better than government has. But still, I mean, in this day and age, it's the private sector actually hold the keys to the data kingdom, not governments. And yet we're so willing to sacrifice our privacy on our mobile phones, just everything. So I think there's a literacy issue around that. And then attached to that, I think there's a literacy issue around understanding the importance of public good versus commercial assets. So it's very important, I would argue, that some data at least are protected as public goods because they're essential to inform public discussion, public debate, to hold governments to account. But increasingly, as data are being privatized, it's very important that access to those data don't disappear and that all data aren't commercial assets. So that there's, again, a trade-off on the profit dynamic. And this is all part of, I think, some future social contract that's going to be required. Jocelyn mentioned some really interesting discussions, in particular around responsible management of data and the challenge that poses for governments. And I think this is a huge challenge because I think a lot of governments are probably ill-equipped, or at least don't feel comfortable around this topic. So, you know, the digital world is changing very fast, and that's changing the data world. And I think a lot of governments are really struggling somehow that this is important, but don't really know what to do. And in fact, the link I put up earlier, I mean, that's trying to surface this discussion to try and say that, look, the UN should be playing a role in helping member states to tackle these issues, how to, but, you know, I think we can help them. The other topic that Jocelyn mentioned is maturity, which is really important for two reasons. One is within the broader data governance discussion, there's a model which is known as the Three Kingdoms model, which is essentially that in North America, the governance model is basically been outsourced to the private sector. In Europe, it's really an individual-based model, which is based on kind of more a human rights approach, but really around individual privacy. And then in Asia, the third model is really state-driven, where the state takes primacy and the individual is less important. There's two crucial kingdoms missing. So there's no mature or homogeneous kind of model that represents Africa, and the same for Latin America. Like, it's not clear what the views are from these two colossally important regions. And why this is important, let me give you one simple example, which is GDPR. So the European model, they've taken a kind of a first mover approach where they've been quite aggressive in saying, if you deal with Europe, you have to adopt GDPR standards, which is fine. I mean, that they're entitled to do that. But what it's done is it's placed a lot of countries who haven't really been given the policy space to think about these issues. They're now effectively being forced down a particular model of data protection or data privacy, which maybe isn't the optimal model for their culture, for their society, but they're being forced to swallow it if they want to deal with Europe. And this is a big challenge, and this is why I think we need to step back and try and have a kind of a more holistic, globalized discussion on how we move data, how we manage data, so that it represents everybody and not just one region. Beatrice's comments, I don't really have anything to say because I fully endorse what Transform Health are trying to do. So all I can just do is applaud their work. There's comments here as well, which, sorry, I haven't had a chance to read.
Yes. Frank Smith is saying about the fact that we need to have the World Health Assembly to endorse a resolution on health data. Of course, it's a wonderful solution, Frank, and I'm sure that all in this room we could work together in order to accomplish that end. I'm just mentioning here our event in the end of this month in Ghent. It's a joint global hybrid summit and with the IHD. Steve, by the way, was also going to be our keynote speaker there, and we could have these communities to all work together in order to promote that wonderful suggestion, Frank, and obviously working hand by hand with Transform Health, which is Steve already brilliantly acknowledged your work and your leadership, may I say, on this area. Okay. Thank you so much, dear panelists, guest speakers. Don't go away because you're still part of the event. But let's now give the floor to participants. I would like to see video on for everybody that's outside from Europe, just to see who is in the room, okay? And I will then, after that, I will call videos on for European participants. Would that be okay? So let's please open the videos, everyone that's watching us from outside Europe, and of course, including the panelists outside Europe, stay with their video on. Panelists from Europe, please turn your videos off. And let's see who is in the room and some voices. Amazing, amazing. Tiago Santos is not okay. Okay, yeah, so good. So the floor is yours, dear participants from outside perspectives, comments. Let's take a round here on your views on what was presented and discussed so far. Anyone?
Hi, Paulo. Sorry for being so late. I didn't hear what you said.
I'm asking for participants from outside Europe to turn video on.
Sorry.
I'll then do the reverse in a minute. No problem, Teresa. Okay, anyone wants to intervene from outside Europe? Perspectives, comments?
We have Pallavi.
Thank you for letting us speak and share our perspectives. I'm from North America, and I think something that really stuck with me was the cross-border health data movement, because I see that when tourists are visiting different countries, it happens that some of them are in a rush, or some of them lack the education to get a tourist insurance, health insurance, right? And sometimes in the US, insurance is definitely needed for us to get the health care. Definitely there is charity care or whatever, but it's really important to get some of the essential services. And I think we also need the relevant data to pull up from across the borders to see to better diagnose it. And I think I'm really interested in learning how cross-border data movement would work and what the unique standards would be. And something that came into my mind when we were talking about this is there also needs to be a specific language, because data is in different languages and different institutes follow different languages. So when we're moving it across countries, it also becomes more complicated, and we need to have like a common language where it becomes easy to transfer data. And I haven't learned much about it, but I think multimodal language models, I don't know if I'm using the correct word, but multimodal languages are definitely something that we might need when we're doing this cross border health data movement.
Absolutely. Thank you so much, Pallavi. Anyone else would like to take the floor now from outside Europe? I will do Europe in afterwards. We'd like to hear from you. Tomoko, you're calling. Go ahead. Open the mic and say something. You're muted. Okay, now I
Hi
hear you.
everyone. Hi. I have just joined. I just finished my exam just now, so come back to you. I'm a bit late, so it takes time to understand what you're talking about. But
Okay.
pleasure to meet you.
Okay. Now it's good to have you here in the meeting room from Asia. Where are you calling from?
Hong Kong.
Hong Kong. Oh, it might be late.
But I'm Japanese. But I
Okay.
have a lot of things to say for collecting my research. I have been I'm studying addiction, and living here it's hard to collect data. And normally I have a lot of things to say, but I have to listen what you have been saying. So sorry.
Thank you so much, Tomoko. Thank you so much. Okay, so Jocelyn, Beatrice, maybe you'd like to call the round and then we'll open the floor for Europe.
Paul, sorry, there's a Victorian wants to speak.
Oh, Victorian, please go ahead.
Thank you
Turn
so
on your
much,
video.
Steve.
Yeah,
Unfortunately, I'm unable to share my video now.
that's
My name is
not.
Victorine Vondi, and I'm joining in from Ghana. I
Mhm.
just saw the event lineup on LinkedIn, and I was particularly interested in the topic because of my personal experience in the health sector and coming out from the health sector, being a patient, so being on both sides. I joined in late, but I noticed there is a gap between the knowledge that patients have and then what they can do with that knowledge. For instance, if a patient is on admission, because of the way that the health system is now being digitalized, they are not given prior knowledge to their health information, given the restrictions that are in the system currently. So, for instance, if we are talking about how the private systems or the private businesses have access to data, how private businesses have access to information, and how people are liberally giving this information to businesses, then we should also think about ways that we can educate patients, ways that we can educate people, especially on the African continent, so that they are aware of their rights and aware of the ways that they can ask for this data and they can be, autonomous in some of these decisions that are being made. Because when you realize that private sectors are able to get this information, that's because they are making adverts and they are making marketing systems ready and they are making available structures and putting in systems to gather this information. So what are we also on the health side doing? What are we as ambassadors, as leaders, as policymakers? What are the structures that we are putting in place to put in youth ambassadors, people that can speak the language of the youth, people that can educate peers and educate people around them, especially on the African continent, so that they can be aware that, hey, your data is needed, hey, your data is needed to make decisions, but it will be very important for you to release that data so that we can, use them for these decisions. And not so importantly, releasing the data, but also getting access to that information whenever they themselves need it as patients to inform the decisions that they have to do. So randomly, these are the thoughts in my mind now. How can we, build systems, empower the youth, let them know of the systems available? Like, for instance, this event is an amazing event. How can we share? How can we let people know that, hey, there's this conversation going on around health? You have access, you have a voice, you have a way to air your views. There are these opportunities. How can we make known these things? How can we find ambassadors? How can we find youth voices to speak on some of these things? I feel like a lot is going on in terms of health, in terms of the digitalization and everything, but we are not involving people on the grassroots as much as possible. Sorry, my thoughts are a little bit sparse, but yeah, this is a little I can share. Thank you very much.
Oh, thank you so much, Victorine. You contributed brilliantly. Okay, so anyone would like to take the floor, and before we pass over to Europe's worldviews? Jocelyn, Beatrice?
Jocelyn, do you want to go first?
Of course. Thank you, Beatrice. No, I mean, I think that it is extraordinary, as I mentioned, that we are speaking about these topics. And I love the way how participants are engaging. So it is very, very appreciated to hear their insights as well. So why don't we take advantage of the few minutes that we have to listen to the rest of the participants?
Great. Awesome. And Beatrice, any final comments before we pass to Europe view?
Yeah, just very, very quickly, with regards to some of the comments shared by Victorine and Pallavi. One of the things that she talked about is how do young people, for instance, interact with the healthcare system, and how much knowledge do people have, how much do they not have with regards to the healthcare system? And I think that's a very valid question to ask, particularly as we have conversations around health data governance. And my colleague Pank talked about a health data governance framework, or these standards being passed as a resolution at the World Health Assembly. And I think that's a great starting point by having sort of this overarching step where you know countries come to an agreement what we want to do with regards to health data. These are the minimum standards that we're going to enact in our different contexts, obviously going to contextualize them based on our needs, based on our priorities, but this is essentially the baseline. And I think an important part of that would also hinge very much on how does the healthcare system relate with the people that it serves. And I think in the framework or in these considerations, we need to we need to be very intentional with regards to the information and the coming to healthcare workers to be able to then pass on this information to the health seekers, for lack of a better word, and then also having public conversations around what does health data look like, what is digital health in itself, and how does that then feed into health data? What does health data look like? What does it encompass? And then I think that would be a really great starting point for health seekers to be able to engage with this very huge conversation, because it does feel very technical a lot of the times. We're talking about health data, but I think as we look at how people interact with healthcare systems and how people very freely give their data to like supermarkets, for instance, but feel very cautious when it comes to the healthcare system or their governments, I think that's also a very important starting point. Empowerment through information and really engaging people through campaigning and like public and political conversations to really sort of have that multifaceted approach, so that we're not just having these conversations at global levels, in boardrooms and the like, but people who are also interacting with the healthcare system, whose data is being collected, whose data is being used to shape, the overall healthcare landscape, are also involved, and they have an opportunity to shape what conversations around health data look like, what One Health also look like, as sort of an all-encompassing sort of structure. That would be my final comment.
Absolutely, absolutely. I particularly like the way you refer to also include One Health on the picture, on the equation. It's going to be challenging, I am sure. Okay, folks, so now please turn off your cameras, and Europe, participants from Europe, please cameras, and let's hear from you. Anyone would like to comment on what was shared so far?
I can start.
Go ahead.
So, hi, my name is Tamara. I'm a president of a Portuguese patient organization that supports families affected by hereditary cancer syndromes, which is in fact a super expensive cancer because it hits on the peak of fertility and productivity. It represents 10% of all cancers, and it still kills young mothers. So I don't know if you had this information, but early onset breast cancer is globally the first cause of maternal orphans. That means we have a lot of work to do there. When the mother breaks away from the family structure as the main pillar, it's catastrophic for the family as well as for the system. So we do not have any data on hereditary cancer, especially in Portugal. We have no idea how many hereditary cancer patients we have, and even less how many genetic mutation carriers with a very high risk for hereditary cancer. So They get sick, mostly late-stage diagnosis, because nobody would believe that women could have a very aggressive breast cancer at 27 years of age. And because of this lack of data, we also feel a stagnation in research and development. We do not really progress. So we've decided to generate data bottom up. We will launch very soon Evita platform, which is main super focused on the user. It's for any citizen that is worried about the personal cancer risk. It's for any genetic mutation carrier, and it's for any cancer patient. We believe that we generate new knowledge coming from the user that will help us to identify better the real and urgent needs in hereditary cancer, but not only, also for other cancer patients. And we take all the responsibility for the data into the hand of the user. So we do it the other way. We tell the users that there are services for them available on the platform. We can do inclusive genetic counseling on the platform, for example, which has huge waiting times, especially in Portugal. So we can shorten this waiting time, because people are getting sick while they are waiting for their genetic counseling or for their genetic testing or for their test result. They are getting sick. And we want to accelerate that. And we ask people if they would mind to share their pseudo-anonymized data for research purpose. And anything that happens with the data, the user is in charge, and nothing happens without an informed consent. So we think that that's an intelligent approach to progress in some way, in a good manner, patient-centric manner. And of course, we are collaborating with a highly professional tech firm that is developing the platform, and also with a lawyer that is specialized in data protection. This is will be a very innovative project, which we hope will turn good research into excellent research. Thank you.
Thank you. Thank you so much, Jocelyn. Any more voices? I ask participants outside, please turn your videos off now, as you can still listen, of course, and I'll bring back the panel to the closing. Speaking to Jocelyn in particular, and anyone else outside Europe. Now, Europe participants, it's your turn. More comments, observations?
I'll jump in quickly. If you can you hear me?
Can you hear fine, Frank? Yeah.
Lovely, thanks. Well, first of all, thanks so much for this great event. It's been really interesting to hear the different perspectives, and specifically to hear this continuum between human health and animal and environmental health. I think it's critical, and digital technology will be able to break down boundaries increasingly and force us to rethink the health from a different perspective, and to integrate that continuum in a far more coherent manner. So that's great that this conversation is happening. From a data perspective, yeah, there is a paradox that's been mentioned a number of times between the way people consider data. I mean, digital means it is data in many ways, and it's quite strange that people continue to see data, especially health data, as the byproduct of the medical examination, even though they value their sort of digital selves in specific areas, shopping, for example, but they don't value that within health. And maybe because health sits at the nexus between, or digital health and data sits at the nexus between two areas of specialization that people don't feel they have access to. One is the medical world and that specialization, and the other one is that informatics, technical world and the specialization behind that. What we're trying to do at Transform Health, we're trying to break down that boundary. We're trying to get people to reevaluate their data, their health data, as an intricate part of themselves, as part of who they are in a digital age, and try to encourage them to take more ownership of that data. We've got a campaign live at the moment called My Data, Our Health, and part of that, we've invited people just to go down and to their health post and ask for their health data. Just ask a simple question: can I have my health data? And we've been working across 6 countries, and it's been a fantastic set of responses. Some people have got it quite easily. Others have been charged for it. Others were told they're not qualified to have it. Others, funnily enough, have been told that their data has been lost or is fragmented across different systems and it's impossible to have it. And so that repositions people and puts them in the driving seat and makes them realize that this is part of who they are, and it shines the light on their right to this particular asset that and part of themselves. So yes, it's been fascinating to participate in this conversation and to see how this takes how this is sort of shaping up within your different areas of the world. I would encourage you to look at the My Data, Our Health campaign on the website and to please promote that.
you.
And Paul, thank you so much for promoting the need for a health data governance resolution at the WHA.
It's amazing, Frank. Obviously, the portal you just mentioned, it's open for everybody in the world, not just specifically Europe region, right?
Yes, that's right.
Okay, so that's amazing. Congratulations on that initiative. I will definitely try and do that myself. So we have more questions here, Sophia, right? More interventions?
There's Despina is looking to, or she had her hand up.
Yes. First of all, thank you very much. It is wonderful to hear so many people from around the world and your views on One Health and how this will change anyway in the future. Just 2 reflections, 2 things the latest years in the digital health industry or market, I would say. And before that, I was in the banking industry. And I have to say, I lived the transition between I do not trust to give my data to the bank or to access internet or to access mobile application. And I remember when we first launched a mobile application in Greece. I am from Greece, so I lived abroad, but in Greece, when we decided to launch a mobile application in the banking industry, you cannot imagine a traditional Greek bank, how the customers reacted. And I have to agree with Frank and the rest of you that you build step by step the trust. A government or a public or private company, you have to build the trust, the maturity, and to train the people is part of this. So I fully agree with this campaign concept that you just mentioned, that helps people start trusting and motivates them. If it is for their own wellness and for the good for them, and they start believing in that, then they will trust you and they will share. And it can be a step-by-step approach. First, it's the minimum amount of data we want them to share or trust. So think about that. When we started a mobile banking app, and it's maybe stupid to mention, but we didn't do money transfers. We did view your bank account balance. So start working with the health. It reminds me a bit the history of banking industry in the past. Not that I say it's the same, because one is extremely private and sensible data that I feel maybe awkward about my health data. And I don't want anybody to know, because I don't want to accept my problems or whatsoever. Or let's say if I have medication taken that I don't want anybody, I want it out of the records. But still you can start, step-by-step approach. So I believe on this training, show to people the benefit they will have, compare with private companies that they do take their data. So after COVID, also the governments gained some trust, because we couldn't really do else. We had to trust the government on some digital related fields, so health can follow. And this is one comment, or at least a lot of comments. I'm sorry, I'm like extreme on my different aspects that I touch. And the second thing I was thinking during your discussions about the environmental, social, and governance, which is a framework about people's health, about ethics, about the environment. I'm thinking on the other side about One Health, how we actually, you need to build synergies between different international, if you like, frameworks in my small little mind in order to leverage from other things. If you start connecting the dots and create synergies between different, how can I say, initiatives, international or specific, like, let's say, European initiatives, I think you can manage a lot if you start seeing it in a holistic approach. That's my view. That's it.
Thank you so much, participants. It's great to have your inputs and comments, but we are to be conscious about the time. We have 2 minutes to go before we close. I still would like to say a farewell goodbye round on the panelists, and of course a final comment to Steve before we jump into a video that I have recorded from Deepak Kalra, the president of the IHD, but that could be while we are closing the session. So if there's last minute comments, please go ahead. If not, we'll pass to the panel. No more comments. So please, thank you all. So a round of applause for participants here. Thank you so much. I'd kindly ask now the panelists turn the video on. Panelists, please, participants turn video off so we can have a final farewell round here. And last closing comments to Steve, and then we'll start a video presentation. And while I start a video presentation, I'll do a little bit of breakout rooms so that people that are in the room and have time to spend here, you can talk to each other. I will create these breakout rooms in a minute so you can talk to your neighbor. I'm going to do breakouts of 3, so you can probably find others to be in your breakout. They will be by chance, so maybe you have the chance to meet with someone you know, but maybe you don't. You meet with someone you never knew, and that's also part of being human on the internet. Panelists, final word from all of you, please. Sophia, I don't know if you want to say something, but you are muted. Okay.
I go first very quickly. Well, thank you very much for the truly amazing discussions, and it's certainly a very big umbrella topic that we can go in so many different directions. But also what is great is that we are exposing the challenges and doing our best to work together to push these agendas forward. And I would like to highlight like some of the things that we are seeing now, including concerns around AI and legislation, for example, in the America government, but also we're seeing, for example, in the Netherlands, they have new legislation for healthcare organizations to exchange data. So I think this is very important that we must follow the front runners, the innovators. Particularly, I always admire the Nordic countries because they open innovation to startups and they have this mentality. And Steve, you mentioned in your presentation, the culture is truly, truly important in taking a risk and doing things right. Of course, is always that side of the balance that we can't take too much risk and put people at risk, but also we're talking about data. For me, it's not actually a concern to share my personal data. Perhaps Google knows that I am online and I haven't left the house this morning, and I live in Brighton, and if I go to the so they know everything about me. So for me, it's not a concern sharing personal health data. is for me is actually the other way around. I want to contribute to the industry and to the world. But I'll leave you with these thoughts, and thank you so much for having me, and it's lovely to see you all.
Thank you so much, João. Really, really good. Anyone else? Panel?
I can go after João. Yes, I can also say that it's a real pleasure to be here, to know what Stevens is thinking and doing. I think this is a topic for the moment, clearly. I just would like to reinforce this need for citizenship literacy on data, clearly. Data is crucial, and my perspective is sooner or later we have different topics around data, but one of them is I see that data is also nowadays represents money, and clearly is one of the things that we need to be aware and talk. And that's it. Thank you very much for this time together with you.
Thank you so much, Anna, for being with us. Anyone else from the panel would like to comment? As closing comments, please brief, and final words for Steve then.
Yeah, sure. I'll go next. So yeah, thank you so much, everyone. It's been a really enlightening session. It's been particularly exciting to learn about the concept of One Health and how that can feed into the very different spaces that we're all working on to, for sort of the collective good. So that's also been really interesting. To also learn about dependency ratios and raising questions around, what the sort of population growth is going to look like with sort of the extremes such as Africa and Asia with, expecting population growth, and questions around, demographic dividend. I think those are really great questions to start raising right now, because that also feeds into how, what the future of health data looks like, and One Health in its entirety. So it's been really great to see that, and yeah, super appreciative for the perspectives shared by everyone on here. It's been really great to hear from all of you. Thank you.
Okay, thank you so much, Beatrice, for your final words. Last but not least, Jocelyn.
Thank you, Paul, very much. Yes, my final thought. The health value created by the use of data should equitably benefit individuals and communities. Data are provided by people either as individuals or as communities. So people should have an equitable share of the health value created by this data. Let's not forget that the owners of the data are individuals and communities, and that we have to take into consideration the different lenses of the different communities in order not to leave anyone behind. Thank you.
Thank you. Thank you so much, Jocelyn. And Steve, over to you. Final word, and we'll go for the video recording of Dr. Deepak Kalra and some breakout conversations.
Okay, well, thank you. Well, first of all, again, thanks for the invitation to speak. Thanks for the discussion. It's been really, really interesting. I just want to come back to really, well, I want to just say, first of all, to Pallavi, thanks for your comments. I think the language issue is really important. So that's a very good point. Frank earlier made a point about the reluctance maybe of people to engage with their data, maybe because they feel they don't have the expertise, either in digital or in health. But a number of people, like Vondi made the point as well about patient concerns. And I think it touches on the points that Anna made around literacy. I think it's really important that we try and surface this issue when people aren't ill. And the reason I say that is a number of people talked about the ethical dimension, which is really important. I always have a worry if there's surveys or if there's data being discussed in hospitals and we're approaching a patient who's ill, that patient is already vulnerable. And they may, you know, depending on how the question is posed, it may sound like maybe not a threat is too strong a word, but if you don't share your data, this is somehow negatively going to impact on the healthcare you're going to receive. So then they're going to give permission because, you know, they're sick, they want to get fixed. So I think questions around kind of data sharing, who has access to my data, that they should be done at a time when people aren't sick, like, you know, when they're healthy, when they're kind of thinking about this more rationally. So that's just a concern I have around kind of patients in particular. I just think they're at a particular moment in their life when maybe they will sacrifice stuff because they're just really vulnerable. And we need to protect against that because we're really trying to look after their health in every respect, not just their health, but also their digital health and their data health. And with that, I'll stop. So Paul, thanks again for the invitation and lovely to meet everybody. If you don't mind, I'm going to be very rude. I have to dash to another meeting. So I'm going to log off, so I won't join the breakout rooms. Apologies.
No worries at all, Steve. Now we are fulfilling our time commitments to our audience. So from now on, the time is volunteer. I know that our viewers in social media are still with us. So without ado, I'm going to start a final video that we have here on a record for you, an intervention from Deepak Kalra that previously recorded for us. And then I'll start the breakouts that you'll be able to join if you like. And for our social media viewers, here's an intervention from Dr. Deepak Kalra and the European Health Data Space.
The European Commission has published a proposal to establish a European health data space, a multi-billion program to help ensure that every European citizen can have access to their health data wherever they travel within Europe, and any health professional who sees them with patient consent can access that record. That means every patient should be able to enjoy safer and more effective treatment, whether they're traveling on a holiday or business, or they're going across borders to receive continuity of care because they're under a team in another country. It doesn't matter what the reason is. What matters is their data can travel with them under their control. And that is half of the ambition of the European health data space. The other half is that the data sets that are often collected inside individual countries and which could be usable for research are made available for research right across Europe in a standardized and highly protected way, so that research, public health, health services improvement can really benefit from the data, really improve care, advance innovations in treatment, in vaccinations, in artificial intelligence, but always in a highly trusted way. This is the double excitement of the European health data space.
It's a major opportunity for health data, what are really the concerns that the industry might have in relation to this opportunity? Are we in the same wavelength when we talk about interoperability standards, for instance, and not talking also about security issues when data travels with the patient wherever the patient goes in the EU?
It's really important that patients are confident that when their data travels around Europe, with their name, with their date of birth, with their details, because they're receiving healthcare, and it has to be identifiable for that purpose, that it's secure. And these information security measures are already being put in place. A number of countries within Europe already have established secure connections between them. But the additional layer that the European health data space wants to introduce is citizen controls, so that people have a stronger role in determining who within Europe can access their data and for what reason. If they're conscious and alert and awake, they can give their authorization. If they're unconscious, then of course it needs to be an emergency situation, but only by people who deal with emergencies like ambulance crews and emergency departments.
But isn't this a challenge, Deepak, for the industry? Are really the tech providers ready for offering such a level of individual degree of control on the data that is circulating around the EU?
I think our industry is ready for this. The interoperability standards that are needed have been published, and they're not brand new standards. They've been around for a few years. But I think what we've really missed is a strong market drive to push for their adoption and to give industry a business case for really addressing how they can export and import this data in an interoperable and secure way. So the EHDS brings a business opportunity cross-border. But if you add to that the benefits within borders, when a patient is moving between two cities within a country, they need exactly the same thing.
Exactly.
So what we're already hearing from member states is that they will take the EHDS approach and reapply it internally as well. So what I hope is that we see European citizens benefiting not only from cross-border, but within border. So really pan-European continuity and safety of care.
That will be a dream come true, right? But so
I think it's a dream for industry too, because if industry can deliver that, and the capability exists, the technical capability exists, nothing has to be invented. New standards don't need to be created. I think industry will see that the increased connectivity that they offer between systems, between healthcare providers, within and across countries, will stimulate their own market.
That's awesome. But Deepak, and let's go to the practical details. So I'm a patient. I go to an hospital. I go to a health center. Is my hospital health center required to do anything in order to become part of this European health data space?
Well, yes, I think that the first thing that has to happen is every electronic health record system in every provider has to be capable of importing and exporting data to the European standard electronic health record exchange format. So many of the systems already in place probably can do this today, or they can do it really easily. A few systems might need to be more radically updated to be able to do it. But there is another step, and that is that we need clinicians, hospitals and GP practices to really care a lot about the health data they are collecting and looking after, because it won't be any use if we are able to exchange a list of conditions the patient has if it's incomplete. It won't help us to exchange an allergy list if half the allergies are missing. So this is not only a technical matter, it's about clinical professionalism and culture. It's about healthcare organizations recognizing and really valuing high quality data across the entire health ecosystem. Data quality is therefore a companion, essential requirement alongside the technical side.
Absolutely. And we had the Porto Declaration last year from our joint event in Porto, that I believe that we are going to talk more about this declaration in the upcoming event in Ghent. And to all who are watching, let me just make a note of the next edition of the Health Data Forum Global Hybrid Summit will be a joint event at Ghent, combining the IHD annual conference, and definitely the Porto Declaration is going to be part of the program, right, Deepak? Can you expand on that? And
Yes.
having in consideration that we have here a global audience from all over the world watching at the European health data space is something that can definitely become a world standard in the future.
Well, I think, Paul, it's very helpful that you've firstly linked back to last year's very successful conference that we ran with a huge amount of collaboration with you. We examined in really great detail what are the issues and challenges, the opportunities and needs to make health data of better quality to deliver benefit to all. And we will definitely be holding inside our annual conference this year on the 29th of November and the 30th of November and the 1st of December in Ghent. We will be revisiting data quality, but not repeating what we did last time. We are going to be looking at new, more deep dive situations in which health data can be educated about. How do we raise data quality skills across the health workforce? How do we start to grow a culture and a standard for labeling health data sets so everybody who wants to use a data set knows the quality of that data inside? These are the topics we want to take forward, building on last year. You're also very right to point out that the European health data space has as its first word the word European. And I think it's true that the budgetary investment is a European investment. But the ambition, the vision, the challenges that have to be addressed, the opportunities and the strategies to achieve those opportunities are not European. They are absolutely global. And there's nothing that we will do to make this happen in Europe that could not easily be scaled to a global level. So we would love people from outside Europe to come to our conference as well on the 30th November and the 1st of December in Ghent at the Marriott Hotel. Please come and learn all about the European health data space, the importance of interoperability, the importance of data quality, the importance of giving patients and mobile health stronger visibility in the way healthcare is delivered, because we absolutely need that. And that is also a global agenda for healthcare, is to increase patient empowerment, increase digitization. Digital transformation of healthcare is a global mission, a global imperative, especially to help make health systems more COVID resistant for the future.
Absolutely. And how about the major theme of this year's conference, trust, Deepak? How do you see trust making really a difference in terms of health data quality?
Trust is really important, because the moment we want to look at big data about health, we need the public to really be supportive of that. There are ways in which we can secure the data with information security measures, with anonymization, with aggregation, with federation. So a number of technology measures can be introduced to make the analysis of big data at scale safer. But all of that doesn't matter if people don't trust. And so the concept of trust is not only about whether the measures are technically sound, but whether on a humanistic level, people feel confident. And part of that confidence is, how are we ensuring transparency? How do the public get to know how data is being used, by whom? How do those people account for their use of data? Who is governing this data ecosystem? And then after all that trust, what are the benefits? Did we trust with good benefit, or did we just trust and somebody else is profiteering from the use of our data? How do we really make sure the uses of data deliver back to the people whose data was being used? That is a strong thread through this event.
And that's going to be one important reason why, if you are not registered, please look at the website of the European Institute of Innovation through Health Data, and I will be putting here the website in a minute. But just before we go, Deepak, because I know you're busy and extremely busy in the upcoming days preparing for this event in the end of the month of November. How do you see that in a perspective of global health and becoming Europe a region right now, a region that perhaps is leading in terms of health data trust? Could we be exporting trust on health data in a certain way to other regions, like in the Southeast Asia, India, for instance, in South America? How do you see that collaboration happening?
I think it's really important that citizen trust is earned by good practices and transparency. And I don't think it matters where in the world you are. You still need roughly the same measures, the same assurances. So the good practices don't really differ. I don't think that we would export European trust to others. I think what we would do is to show how we have tackled it within Europe, learning, of course, from other experiences in the world, but putting them into practice as a showcase and saying these seem to be the good measures that win public support. You may wish to replicate those in other parts of the world, and hopefully they would achieve similar benefits. That's what I hope we see. However, Paul, a really important point, and it's a point about our conference, is that it is not a technical conference. It is not an academic conference. It is a multi-stakeholder conference, because these topics that you and I have discussed are not single stakeholder topics. They require multiple stakeholders, and the audience who come to our event are not passively sitting and listening to speakers and PowerPoint presentations. We have a lot of interaction planned because we want to hear from our audience. So the call to the audience listening to this are not to say, please come and listen to our wonderful conference. No, it's please come and contribute your ideas, your thoughts, because we want to co-create the future best practices and the future innovative solutions with you. Please come and help us co-create with you.
That's a lovely proposition, and thank you so much, Deepak, for your time here. And back to the audience now, as we would like to hear from your views here in this global talk. Thanks to the Digital Health Week, we are here being seen by a number of participants, and we are moving now to the next slot in our session, saying goodbye to Deepak as he has to depart for the moment. Thank you so much.
Thank you. Thank you, Paul. It's been a pleasure speaking to you.
It was really great to have you here. Goodbye. See you
Bye.
soon. See you soon in Ghent.
Great.